What's up everyone? Today is part 2 for the snowboard knee series. Today we are talking about the 4 most common knee injuries that snowboarders undergo. Let's get going. Before you watch this, please watch the first part of this. We just go over the quick anatomy of the knee. It'll help a lot when I start talking about what these injuries are and what they affect, so check that out. There is going to be a part 3, maybe part 4 on specific exercises for these 4 most common knee injuries, so check out that in the future, next week and the week after that. If this is your first time here, my name is Mark. I'm a doctor of physical therapy, one half of Mobility Duo with my wife, who is a licensed massage therapist, yoga instructor, personal trainer, etc. We are athletes and health professionals that love working with weekend warriors, snowboard athletes, anything like that, providing you with rehab, prehab, fitness suggestions, strengthening, yoga, etc., you name it. We work hard on these videos, so again, helps us out if you subscribe. So first and foremost, the most common knee injury across the board with most sports is your dreaded ACL tear. So like we talked about in that first video, part 1, ACL is that small ligament that sits inside the knee. All right. Commonly, when it's injured, it's kind of a planted leg, slight bend, and a twist, usually an external rotation. It puts too much strain on that ligament inside, and you will tear or even rupture that ACL ligament. So, thing to note about this is a lot of people have a torn or strained ACL and have 0 symptoms, but there are, like most people, I would say, do tear their ACL and feel it, and the way they feel it is one, either by pain, or they will feel an immediate instability in that knee. So something that we test for immediately after an injury is called an anterior drawer test, and if that tibia, or the bottom bone below the knee, is able to come forward easily compared to the other leg, it's usually a sure tell sign that the ACL is strained or ruptured. The next most common knee injury, I would say, is a meniscal tear. So the meniscus is that tissue that sits inside on top of the tibia. The femur, the bone on top, kind of sits snugly inside of it, and it takes a lot of the brunt of the load, impact, and it keeps the knee stable. The femur sits nice and tight in top of that tibia. So this happens a lot when you do a lot of twisting, things like that on the snowboard. What will happen is you tend to have, like I talked about in that first series, inside the leg, that medial meniscus will tend to tear a lot more often. Again, this is very common. And one of the sure tell signs with this one is you'll feel a clicking when that knee is bending, or even the knee giving way. So if you're walking, going into a bend, you'll feel that knee kind of give out. And usually this comes with some sort of discomfort or pain. So number 3, we have PFPS, also known as patellofemoral pain syndrome. And essentially, usually this is associated with some weakness in the quads. So if you have your kneecap, it sits right here. The kneecap will generally, if the quads are weak because it's connected to the quad on top, the kneecap or the tendon will get pulled to one side, which creates irritation in that patella running on top of the femur. So if it sits snugly inside of that top bone, that kneecap, if those quads or those hips there's weakness behind them or fatigue, the way that patella bone, the kneecap runs inside, generally will create some friction. So there's usually some sort of endurance issue with the muscle there. Last but not least, the dreaded, we have a patellar or a kneecap fracture. So the most famous recently was Marcus Cleveland. I believe he landed on a rail during jibbing or going off a jump, landed on his kneecap. It completely ruptured it, or just fractured it in many, many pieces. So again, looking at that past video, part 1, the patella or kneecap sits inside of a tendon. If you land on the ice or snow, if you have major impact on that, you can essentially, it's like a bone. It is a bone, so you can break that, and you can usually breaks in multiple pieces. The problem with that one is because there's so much pressure or tension in that tendon when you bend and extend that leg, that bone is really, really difficult to heal, and you really, really need to keep it stable for quite a while. So Again, generally there's some sort of major impact if you're landing on a rail, on the ground, on the ice, and that can really get affected or fractured. So there you have it, the 4 most common knee injuries. Next time, part 3 and maybe part 4, we're going to jump into some beginner exercises, maybe some advanced exercises, but most likely beginner, if you are encountering one of these injuries. So it'll just be able to get you started. Again, we offer services, telehealth. We offer kind of online consultations if you're out of state, out of Oregon, Washington, movement consultations. We offer yoga, strengthening plans, all that good stuff. So hit us up, let us know. We love to work with anyone, athletes of all ages, shapes, and sizes. If you have encountered any of these, please let us know. We love to hear from you. Otherwise, we'll see you next time.